So there's fantastic scope for improvement of healthcare in respiratory medicine in Cheshire and Merseyside. If you look at right care data, we could save an extra 234 lives a year from respiratory disease if we were just as good as our peers. We also could save an extra 50,000 respiratory bed days, which is pretty much the whole of the number of emergency escalation beds that have to be opened every winter. And we spend almost £8 million on respiratory prescribing in primary care above our average peers. This year I've been leading a respiratory improvement programme across Cheshire and Merseyside, where we've been trying to bring new people into the workforce. In respiratory medicine there's a massive workforce shortage of specialist nurses, specialist physiotherapists, respiratory consultants, so we really need to bring new people into the workforce. So we've employed physician associates to work flexibly across the whole of Cheshire and Merseyside between primary care and secondary care. So in the summer months they've been working in primary care in long-term condition management of COPD, really getting the interventions that matter to patients with COPD. So those are flu vaccination, pulmonary rehabilitation and smoking cessation. And then they've been making some optimisations to respiratory medications, which are really good for patients because it's much easier to use and also saves massive amounts to the NHS. And then in the winter they've moved over into urgent care to support the frontline workforce, because we know that there's massive demand on our hospitals every winter, so it's to help bridge some of the gap that there is currently. Yes, it's been very interesting how physician associates have been received across the NHS. They're a new workforce, so there's always a little bit of scepticism about something new, understanding their training and that they actually are skilled healthcare professionals who've had a lot of generic training, but then also 2 months of really specific respiratory training. And I have to say that as soon as people across primary care and secondary care have really met them, interacted with them, seen the difference that they make to patients, they've been really well received, and actually now people are saying they want more of them. So we've gained patient feedback throughout the whole programme, and we've had absolutely phenomenal patient feedback. So people feel that the physician associates have really given them time to talk about their condition, help them to understand COPD a little bit better and how to self-manage their condition. They've empowered them, given them lots of information, given them tips on how to manage their condition, and then also made medication changes which have been really favourable to them. So they've managed to go from using maybe 6 doses of medication a day down to just 1 dose a day. So it's really made massive improvements to their care. Okay, so as part of our bid for service improvement in Cheshire and Merseyside, we've managed to develop a respiratory rapid response car with the North West Ambulance Service, where we have a paramedic and a specialist respiratory clinician in a rapid response vehicle going out to 999 calls to try and prevent admissions where appropriate, but also provide care to frightened patients at home sort of as soon as they call. So we've improved the speed of response in a crisis, and then also helped to divert some admissions from hospital. So with the North West Ambulance Service rapid response car, we're only on day 10 at the moment. It's been absolutely phenomenal. The collaboration really between the North West Ambulance Service paramedics and our respiratory clinicians, we've just learnt so much from each other. We've so far managed to intervene in 26 calls and managed to avert 6 hospital admissions. It's been really interesting that we've got a mixture of respiratory clinicians that have been taking part in the car. So it's been nurses, physiotherapists, doctors. It's a whole different mixture of healthcare professionals, because what's important really is not who's there, but that they've got the right skills to deal with the patient in front of them.